My husband walks in and he says he wants to go for a ride. And I was like, I don't know, I had a really bad gut feeling, and it was stronger than any other premonition I've ever had. I don't remember riding that day. I don't remember flying through the air. I don't remember much at all. But I remember the impact. The next thing I remember, I was laying there on the concrete and I couldn't move. I didn't know what happened. And my husband, his face was above me and he was rubbing my head and he said, "You hit me." He was crying. The impact is really, like when I hit him, that plays back in my mind constantly. I don't know, I'm thankful to be alive. The very first interaction with Dr. Hakos, I remember him coming into my room. I had so many questions. Like, all right, what happened? I mean, what do my x-rays look like? He showed me my x-rays before and after the fix, and he's just an amazing doctor. Like my husband said, he put Humpty Dumpty back together again.
The break in her arm was pretty significant. It was everything from her shoulder to about 2/3 of the way down the humerus. All this white is all the metal, so this is the metal plate that sits along the side of the humerus bone and goes everywhere from the top up here by the shoulder joint, almost all the way down to her elbow. Her pelvic fracture had induced a lot of bleeding, and so that was one of the concerns, is that she was losing a lot of blood, and that really sets the urgency for all of it. We augmented this with something called an external fixator, which is what these big white metal pins are here. So those actually go into the pelvis, and there are metal bars that stick out across the front of her abdomen. So that's what these shadows are here.
I had that external fixator in. Once I got that removed, it was like I was free. After that, I started putting weight on my right leg, and now I'm on my way to walking. I'm already walking. Because of COVID, I wasn't able to see my family, and it just made it really hard. While I was in the hospital, I felt like isolated, a little bit lonely.
COVID outbreak in Michigan, or at least here at Henry Ford, really had just started about a week before. If she was not the first, she was definitely one of the first in the operating room entirely to set everything up and put it in a special room and wear special equipment. And then ultimately, a few days later, her test did come back negative and she didn't have it. But at the beginning, we just didn't know and didn't have the time to wait to find out. We had to take her to the operating room and get her fixed.
I have my moments where I just feel down and I just want to cry it out, but my family is there just to keep me moving forward. My husband and my daughter especially, and my daughter is she's been my little helper too. She's my goofy little child, so she's always keeping me laughing. She has been awesome helping me out. There is a very big power in positivity. I knew I had limitations, but I made it a point to tell myself that I'm going to do this again. I'm going to do that again, and I made goals for myself. And it is hard to stay positive all the time, but I do. It's just who I am.
You can't run a test to find out if the patient has that sort of resilience, and Sarah certainly has demonstrated that. She really just set her mind to it that she was going to get better, and she has.
Riding is a way of life, and there's nothing like it. Just being on two wheels, just open and just free, and I don't think I'll ever not ride again. If you fall, you just get back up. Character is how well you do after you've fallen, and I need to stay positive and keep moving forward.